Hello YouTube, this is Sam from Tiger Schooling, and in this session of the video we're going to talk about intercostals. We're going to include the intercostal muscles especially. This would be not about nerves and arteries. We are going to talk about them later in the next video. But before discussing the intercostal, you must understand this diagram, this picture, and then we will get to a real 3D software where you can easily understand intercostal muscles. So let's just get started. So from the outside we have got the skin, and as we move inward towards the inside the body, this is the skin, then we've got superficial fascia, and inside that we have got serratus anterior. That is a muscle, that is a real muscle on the sides of your body, you know, nearby your chest. And on anterior to that we have got the external intercostal. You see this one lying this lying vertically, you know, muscle called external intercostal. Then as we go inward we have got internal intercostals, and as we got innermost, we have got the innermost intercostal. So this is the external intercostal, internal intercostal, innermost intercostals. This is the basic diagram about these intercostals. Then anterior to the innermost intercostal we have got endothoracic fascia, and anterior to that we have got parietal pleura, then the pleural cavity, then the visceral pleura, and finally the lungs. So this is an easy diagram to understand. So you could understand. It's necessary to understand so you could understand the other 3D form. Let's move to that software first. Alright, before discussing the intercostals, we must have an idea about the opening in the thorax. So the thorax or chest, thoracic cavity or chest cavity actually communicates with each other through this thoracic outlet. This is called the thoracic outlet. And you can see that important nerves and vessels pass through this, including this trachea, which is on the anterior side, and the esophagus. You can see on the posterior side, that is the esophagus. And there are a few boundaries of the outlet. The main boundaries include on the posterior side, we have the first thoracic vertebra. This is the T1 on this side. We've got the T1. The first thoracic vertebra on the posterior side. On the anterior side, we have got the superior border of the manubrium. You can see this is the superior border of the manubrium on the anterior side. On the lateral side, we have got the medial borders of the first rib and costal cartilages. You can see this one as well. I haven't shown the costal cartilage in this picture. You can just have a good picture. Just a second, let me show you. You can see now these costal cartilages on the anterior side with the medial border of first rib. And remember that this one is actually placed obliquely, facing upward and forward. You can see that because it's all because of the lungs and pleura, which actually project upward. You can see on this side that lungs are projecting upward in the neck. So that's why it's upward, and it's the thoracic outlet is upward and forward. So this is the basic idea regarding the opening in thorax. Let's move toward the intercostals now. So in this diagram you see all muscles that are on your body, but we are going to remove each muscle layer by layer. So in order to understand where the external intercostal, internal and innermost intercostal muscle lies, so first we get started the external intercostal muscle. So external intercostal muscle is the most superficial layer among the intercostal. So let's find, we gotta reduce the muscle layer. Here you go. Now we have just removed the chest muscles, and you can see this muscle, which is called, this on the sides, which is called the external intercostals. So their fibers actually, direct downward. You can see them closely. Their fibers are directing downward and forward. Downward and forward actually they are from the inferior border. You can see this is the rib, and on the inferior border of rib to the above to superior border of rib below. So there is a rib below over here, and this is leaving from the inferior border of the rib above and attaching to the superior border of rib below. So actually, as muscle reaches to costal cartilage, you can see as muscle reaches to costal cartilage, it is converted into aponeurosis. I haven't shown it in this picture, but when I add up the connective tissue, it is going to appear that there's an epineurisis, which is also called the epineurisis of this muscle is also called as the anterior or external intercostal membrane. So this is the basic idea about the external intercostal, and now let's move over to the internal intercostal membrane. So this is the internal intercostal membrane, which actually forms the intermediate layer between the external and innermost. Innermost is not seen; it cannot be seen here, which is on the most inner side. We will go to look at in just a bit. So this muscle is the internal intercostal, which actually forms intermediate. Its fiber actually direct downward and backward. You can see it's downward and moving backward. The fiber facing downward, or you can say direct downward and backward from subcostal groove. If you know what is subcostal groove, this is over here. There is a subcostal groove. We're just going to talk about it. But above to the upper border of rib below. This is the basic idea. This is the rib below, and this is the upper border of the rib. Below this muscle also converted into epineurisis like the external intercostal, which is also called as the posterior or internal intercostal membrane when it it extends backward from. Alright, if you have a good idea about the subcostal groove, you must know what is subcostal groove. Let's move towards the innermost intercostal muscle. So innermost intercostal muscle can't be seen here. We got to remove the muscle layer here. Alright, we still have these muscles, and still we are on the internal intercostal. We're going to remove this one. Alright, here we go with the innermost intercostal muscles. These are the innermost intercostal muscles you can see, which actually forms the deepest layer among the intercostals. It is an incomplete muscle. You can see it easily that it is an incomplete muscle layer and crosses more than one intercostal. It can't be seen here and clearly in this diagram, but I make sure you understand what I mean by it. Each layer crosses more than one intercostal space within ribs. So internally it has endothoracic fascia. I have already shown it in the picture in the first I have shown in the diagram. You can go back and check that out as well. So internally it has endothoracic fascia. Externally it has intercostal nerves and vessels, which are also shown in that picture. So this muscle can be divided into three portions, which is not given here. So we're not going to. This is all about intercostal muscles, basic idea, and the thoracic outlet. So make sure if you want to learn more about the thorax and continue with our series, please watch other videos, and we'll be back soon.